A UN health worker who was infected with the Ebola virus has died in Germany, marking the latest fatal case of the disease outside of West Africa. And for more, our Paul E. is joining us from the news center. Paul, this patient arrived in Europe last week for emergency treatment. How did he get infected?
Well, health officials say he was a Sudanese doctor who contracted Ebola in one of the outbreak zones in Liberia. And despite intensive medical care at a hospital in Leipzig, the 56-year-old succumbed to the serious infection on Tuesday. The death comes on the heels of a new warning by the WHO on the growing epidemic. Our Connie Kim has this report.
As far as warnings go, they don't get much starker than this. The World Health Organization says this Ebola outbreak is the most severe acute public health emergency in modern times. A statement delivered on behalf of WHO Director General Margaret Chan said the epidemic could even lead to failed states. She added that the outbreak proves the world is not prepared to respond to any severe health emergency. The death toll from this outbreak surpassed 4,000 last week, but Chan did not mention latest figures, saying instead that the numbers are rising exponentially. With the epidemic seemingly spiraling out of control, London's Heathrow Airport will begin screening for Ebola on Tuesday. Around 1,000 people from Ebola-affected nations have arrived in Britain over the last month, and an estimated 85% of them entered the country via Heathrow. Through monitoring, British authorities hope to track their movement and quickly isolate a patient if they start developing symptoms. International concerns about the spread of Ebola outside of West Africa peaked earlier this week after a healthcare worker became the first person to contract the virus within the United States. Connie Kim, Arirang News.